Welcome to Chapter 13, our lecture on Introduction to Muscles, as well as muscles of the shoulder and arm. Little introduction: there are over 600 skeletal muscles in the human body. Most of these muscles are found in pairs. So where there's a left, there's typically a right. The body's pretty symmetrical that way. Skeletal muscles are voluntary and require conscious stimulation. Therefore, most skeletal muscle is not autonomic. Skeletal muscles' functions are movement, posture, and stability. Generate heat. In fact, it's 85% of the body heat production comes out of skeletal muscle. And glycemic control. Most all skeletal muscles cross at least one joint. This allows for movement about that joint. Skeletal muscles have two attachment points: an origin, which is the attachment point of a muscle that does not move during contraction, and insertion, the attachment point of the muscle that does move during contraction. Both of these, origins and insertions, can change based on the movement about a specific joint. Each muscle has at least one action. Muscle contraction usually moves the insertion closer to the origin. Remember, muscle only contracts and relaxes. It only moves in one direction. So for every muscle, there's coordinated muscle action for every movement that goes on. You have a prime mover. This is the muscle that is primarily responsible for producing a particular movement. Then you have synergists. These are muscles that help the prime mover to perform its function. Synergistic muscles are muscles that do the same action but don't have the primary force behind them. Antagonists. These are muscles that oppose the prime mover. So these are muscles that do the opposite action. So if you're naming a flexor, an antagonistic muscle would be an extensor. And then a fixator. These muscles prevent the movement of a bone that the prime mover is attached to. An example of this would be forearm flexion. The prime mover in forearm flexion is the Biceps Brachii. A synergistic muscle would be the Brachioradialis. And then an antagonistic muscle would be the Triceps Brachii, which is used to forearm extension. We also classify muscles on whether they're intrinsic or extrinsic. An intrinsic muscle is a muscle that is contained within a region and has an action on that region, such as the shoulder joint here. All three of the muscles labeled here are found within the region of the shoulder and perform an action inside that region. The extrinsic muscle on the right has an action that is located in a different region than the one it is contained in. So pectoralis minor is located within the pectoralis region, but its action occurs in the shoulder joint itself. Some other key terminology you need to know. Aponeurosis. An aponeurosis is a broad, flat tendon that may or may not have a bony attachment. You can find these primarily on top of the skull, in the palms, and along the rectus abdominis. Fascia. This is an outer muscle wrapping. So around every muscle bundle you have this fascia. Fascia is continuous with tendon, which is also continuous with the periosteum. And retinaculum. Retinaculum is used to anchor tendons. You find retinaculums in an area where extrinsic muscles move through a joint in order to cause an attachment point in a farther joint beyond there. So the extensor retinaculum bundles all the tendons up in the extensor region to go to the fingers, and it keeps them from bulging out. So there's 600 muscles. How on earth do you remember all these names? Well, a couple study helpers would be to pronounce it out loud and study with a partner. Use the textbook and internet to help with pronunciation. A lot of dictionaries online these days will have an audio category with them. Most commonly, the name of the muscle often tells you something about it. Its size, for example. Maximus would be the largest muscle in a specific group. Its shape, trapezius, is talking about a muscle that is very trapezoidal shaped. The location, the brachii, which is found in the brachial region. In action, levator probably elevates that body part. Orientation, so there's superficialis, profundus. Superficialis is more superficial, where profundus would be the deepest muscle. And the number of heads. So, for example, quadriceps has 4 heads, biceps has 2 heads, triceps 3. The difference between the arm and the forearm is the arm is the brachial region and the forearm is the area below the elbow, often termed the antebrachial region. For Chapter 13, you must know the origin, name, insertion, and action for these muscles listed: Trapezius, Deltoid, Pectoralis major, Latissimus Dorsi, Biceps Brachii, and Triceps Brachii. You must know an action for all of the muscles located in Table 13.1, and you must be able to identify synergists and antagonists for each muscular movement that these muscles have. You do not need to know any of the innervation located in Table 13.1. Let's get started. The trapezius muscle. This is a large trapezoidal shaped muscle found between the neck and the upper back. It originates in the posterior occipital bone and on the vertebral spines of C7 through T12. It inserts on the clavicle, the acromion process, and the scapular spine. Its actions are to extend, abduct the head, rotate and adduct the scapula, as well as fix the scapula. Now, in a quiz situation, if we were to ask you an origin, you would only need to list one origin. Same with an insertion and the same with an action. So I recommend learning one of each of these and memorizing them. Deltoid muscle. This is the large bulbous muscle that creates the most superficial aspect of the shoulder. It originates on the clavicle, the acromion process, and the spine of the scapula. Inserts onto the deltoid tuberosity of the humerus. Should be fairly easy to remember. And its actions are to abduct the arm, flex the arm, extend the arm, and medially and laterally rotate the arm. Pectoralis major and minor. Again, you only need to know the origin insertion for major and an action for minor. So, major originates on the clavicle, the sternum, and the cartilages of ribs 1 through 7. It inserts onto the crest of the greater tubercle of the humerus, and its actions are to flex the arm, adduct the arm, and medially rotate the arm. Where the action for pectoralis minor would be to depress the glenoid cavity and raise ribs 3 through 5. Latissimus Dorsi. Latissimus Dorsi originates between T7 and T12, L1 and L5, along the iliac crest and along ribs 10 through 12. It inserts onto the intertubercular groove of the humerus, and its actions are to extend the arm, adduct the arm, and medially rotate the arm. Infraspinatus and supraspinatus. These muscles are named for their locations about the spine of the scapula. Supraspinatus is found above the spine of the scapula, and its action is to abduct the arm, as well as stabilize the shoulder joint. And infraspinatus is located about its position, which is below the spine of the scapula, and its action is to laterally rotate the arm and stabilize the shoulder joint. Subscapularis is a large muscle that spans the subscapular fossa of the scapula, and its action is to medially rotate the arm and stabilize the shoulder joint. Teres minor and teres major. We list teres minor first because it sits superior to teres major. Teres minor's action is to laterally rotate and adduct the arm, as well as stabilize the shoulder joint. Teres major action is to extend, adduct, and medially rotate the arm. Biceps brachii and Brachioradialis. These muscles are named for their location as well as the head of the muscle, so biceps brachii, a two-headed muscle found in the brachial region. Brachioradialis is a muscle that's found in the brachial region and along the radial bone. So, biceps brachii consists of a long head and a short head. Their origins are the long head, the superior margin of the glenoid fossa, and the short head, the coracoid process of the scapula. Both muscles insert onto the radial tuberosity, and their action are to flex the arm and forearm, and these are the primary muscles that supinate the hand. Brachioradialis you only need to know the action of, and that's flex the forearm. The triceps brachii consists of three heads: lateral, long, and medial. The origin is the infraglenoid tuberosity of the scapula and the lateral and posterior surface of the humerus. And now for a different view, an anterior view, you can see the lateral, long, and medial heads. And their insertion is the olecranon process and the ulnar tuberosity, both found on the ulna. Their actions are to extend the arm, adduct the arm, and extend the forearm. Coracobrachialis and brachialis. You just need to know the actions of these two muscles. So coracobrachialis flexes and adducts the arm, and brachialis flexes the forearm. Your rotator cuff muscles. There are four muscles that make up the rotator cuff. The primary function of the rotator cuff is to stabilize your shoulder joint. So all the muscles that I read about and the actions that said stabilize shoulder joint are the muscles that make up the rotator cuff. They are supraspinatus, infraspinatus, teres minor, and subscapularis. A mnemonic to remember this is SITS. These four muscles are responsible for holding the humerus into the glenoid cavity. This is the end of the muscles of the shoulder and arm. Be sure to name each muscle, identify its location on models and pictures, know actions for all the muscles, know synergists and antagonists for each muscle, and know the origins and insertions for the muscles listed earlier. Again, you don't need to know any innervations. This will do for Chapter 13. You have a great day.